In the biggest clinical trial on sunscreen, which is the NAMBA trial, they looked at discretionary use of sunscreen versus everyday use. And they found a huge difference in the aging. So people who are using sunscreen every day, they found that they had, I think it was over 5 years, and these people were middle-aged. And they found that there were no increased signs of aging. Niacinamide, vitamin B3, is also another one which has a lot of effects.
Dr. Michelle Wong, welcome to the channel.
Hi, really nice to be here, Brad.
So most of the viewers of my channel, they know the profound benefits of sunscreen for slowing down the signs of aging, and we can see some striking examples of these benefits from some of the published before and after photos that we've got in the literature. But what's less clear is the side effects, specifically the concept around endocrine disrupting chemicals that may be contributing factors towards the declining testosterone levels that we see. So there's even some clinical guideline databases such as UpToDate that suggest that mineral-based sunscreens, so for example titanium dioxide and zinc oxide, they're now recommended over the other ingredients that are included in the sunscreens. So I just wanted to check, what do you think of these safety concerns and how do you select a sunscreen?
Yeah, so I had a look at UpToDate, and from that article, I couldn't actually see the actual article, but I could see the full reference list. And I think where that diverges from, I guess, mainstream opinion within the sunscreen and cosmetic space is that the two main authors who are scientists, they specialize mostly in vitro and animal studies of endocrine disrupting chemicals. So the reference list is very heavy on in vitro, which is like cell and mostly cell line studies, and also animal studies and animal cell line studies. So yeah, that's all their reference list. And it's actually missing a whole bunch of human studies, which is kind of unusual for a review on human impacts of sunscreen because essentially, when you're looking at risk, there are two parts to the risk of any substance on our bodies. There's hazard, which is what it can potentially do, and there's exposure, which is how much you actually get, how much you're actually exposed to. So the hazard part is usually done via in vitro and animal studies, so you can see which receptors it reacts with, which receptors it hits, what sorts of microscopic disturbances you see, what sorts of things might happen to animals. And most of the time in these animal studies, you have the animals being fed really large amounts of sunscreen. So they're essentially trying to see where the line is, where something actually happens. So they have that aspect. And this is also what happens with databases like the EWG's Skin Deep database and a lot of those clean beauty apps that people are using to scan their products. So what's missing is the exposure part, which is how much do we actually get as humans when we put it on our skin and it absorbs through our skin. And also when we use it in a sunscreen, which is a very low percentage compared to how much is actually being fed to a rat, for example. Sorry. So a lot of the human impact studies, you'll see this with things like, there were a bunch of articles about FDA studies in 2019, 2020, and that was where the FDA put sunscreen on people's skin in realistic-ish amounts and then measured how much was actually getting into the blood. So that's an example of an exposure study to see how much we're getting and how that compares to the amounts that were found to be harmful via these rat and animal line studies. So, I think they really should have maybe gotten a toxicologist who could have had a look at this exposure study and adjusted the risk based on that. So this database was also quite heavily US biased, I believe. And this is a big issue because US sunscreens have a lot of different chemicals compared to Australian and European sunscreens and also Asian sunscreens. Basically, in the rest of the world, there are a lot more sunscreens available. The US only has about 7 commonly used chemical filters in their sunscreens, whereas in Australia, in the EU, we have about 30. We've got like a good 20 more chemical sunscreens. And all of these they have very different risks in terms of exposure, especially, and also in terms of the hazard. So a lot of the newer sunscreens are actually designed specifically so that they don't absorb as much into the body. So it's quite difficult to have any sort of broad statement on the risks of sunscreens, even if we limit it to the ones that are in the US, the ones that are approved in the US and everywhere else as well. So One of the reasons for that study is because the US regulates sunscreens in a very specific way. First off, they are regulated as drugs in the US. They are also in Australia, but the rest of the world mostly regulates them as cosmetics, maybe a special category of cosmetics, but generally cosmetics. And for the FDA drug approval process, they only look at very specific types of data. So that is why at the moment in the US, the only two sunscreen ingredients recognized as what they call generally regarded as safe and effective are the two mineral sunscreens, so zinc oxide and titanium dioxide. And yeah, it was based on these FDA absorption studies where they put the chemical sunscreens into this other category, like not quite grass. So the reason for that is because back in the day when sunscreens were first approved, they assumed that not enough of it absorbed into blood to have any effect. So the FDA has this guideline, which is if less than half a nanogram of a particular substance per mil ends up in blood, then it's assumed that there isn't enough in blood to really hit enough receptors to cause any sort of long-term health effect. And they assumed this was the case until 2019. So funnily enough, there was actually quite a few studies that suggested this wasn't the case back from like the early 2000s, but the FDA just kind of ignored it until 2019, 2020, did these studies, announced that they suddenly discovered this. It went all over the headlines and it was like a big deal. But in a lot of other regions, like the EU, they've been looking at this early 2000s data for a long time, and they've actually been using that in their risk assessment. So I think if we look at the EU safety assessments, it's actually a much better gauge of the safety of sunscreens that's more up to date. So in the last couple of years, the EU has actually named a number of ingredients in cosmetic products that they wanted their scientific committee to reassess based on the possibility that they were endocrine disruptors. And these, I can't remember how many there were, but there were about 20. And it included 5 common chemical sunscreens, which are oxybenzone, octocrylene, 4-MBC, homosalate, and octinoxate. Titanium dioxide is actually also about to get reevaluated for a different safety concern, which is, you might have heard about the food ban, like titanium dioxide in Skittles, I believe, is getting a lot of traction on social media. Essentially, titanium dioxide has concerns with reproductive and genotoxicity. Anyway, so back to the chemical sunscreens. So the EU safety assessments, they reassessed these and looked at all the up-to-date information. And so far, they've done 4 of the chemical sunscreens. They're still to do octinoxate, but octinoxate is regarded less risky. It's in the category 2, which is why they're getting around to it later. So after looking at that, they found that only one of them, 4-MBC, had enough evidence to say that it could potentially be an endocrine disruptor. And that's also at the concentrations at which it's being used. So they found that there was insufficient evidence to work out at what dose it was going to have an effect. So they said it was probably best to avoid that for now. But also, if you look deeper into the safety assessments, I actually find it really reassuring how they do the safety assessments. So essentially where they get to is they look at all the hazard data, all these animal in vitro studies, also any relevant human studies, and they work out how much is expected to not have a harmful effect. So they'll set a dose. Let's say it's like 100, just some arbitrary unit. 100 is how much is expected to not have a harmful effect. Let's say they worked out 150 is how much where they have a harmful effect. So they will limit the dose allowed to 1% of that non-harmful dose. So you end up only being allowed 1. So if you look at the percentages they're still allowing, it's things like 6%. So that means you would need to be applying 600% of that ingredient onto your skin in a sunscreen, which obviously is impossible to have that harmful effect. And most of the time that harmful effect is observed in pregnant animals. So obviously pregnancy is a riskier time because you have a developing fetus. And so this is all based on developing fetal data. Most of the population isn't in that situation. Plus there's that 100-fold safety margin. And so Yeah, that is actually super reassuring, I think. And I highly recommend if anyone is worried about sunscreen safety, you can look into those. So I guess the next part of the question is what would I recommend people do if they're worried about effects of sunscreens? I guess you could potentially just avoid all chemical sunscreens and titanium dioxide and just stick to zinc oxide if you're super concerned. But I guess the big problem with zinc oxide is that it is a pretty crappy sunscreen ingredient. So it just does not absorb UV very effectively, which means that you need to have a really high percentage. It's somewhere around 15-20% to get SPF 50, and even then, it's not really reliable because a lot of the time it clumps up on skin. So the individual particles will actually aggregate over time. Sometimes it even does this in the bottle. And it does this especially when you go into the water. So there's been a lot of consumer studies done over the years where, especially in the US, zinc sunscreens tend to fail the water resistance test in use because, they like zinc, it's basically crushed up mineral. It just does not spread very nicely, unlike a chemical sunscreen, which can spread really smoothly. Even titanium dioxide is usually a lot better because they coat it in more organic substances. So that also means that you end up with people under applying because you have such a poor texture, but sunscreen, how well it works, how much UV it absorbs, depends on how much you have on your skin. And then on top of that, there's also white cast. So pretty much anyone with darker skin, like even medium toned skin, even people with light skin sometimes will see zinc oxide sitting on their skin. And that encourages people to apply less. There's also sometimes UV SPF boosters in the products, which is basically they are chemical sunscreens that are a few atoms different to an actual chemical sunscreen. So it's sort of like a loophole where you can put these ingredients that are, essentially the same as octinoxate, for example, or octocrylene, but a little bit different. And then that can go into a sunscreen and like kind of fly under the radar. And so those are in a lot of zinc oxide sunscreens because zinc oxide is so crap. They basically have to put a fake chemical sunscreen in there to make it work as well. And the problem with these is most of the time, looking at the structures, the risks are very similar to chemical sunscreens. So first off, you're not really avoiding chemical sunscreens. And secondly, if the properties are different, they're not getting assessed under these safety assessments, and there's no real limits on the percentages. So I think just on the face of it, that is actually a riskier option than a properly approved, properly regulated chemical sunscreen. So if you do find a zinc sunscreen that doesn't have these SPF boosters and you love it and you can apply it sufficiently, then I think that is probably the best option for you. But I think most people do not have that luxury. So I think if you don't have that luxury, then I recommend firstly reading through these safety assessments because they are really, really reassuring as to how safe they are. And secondly, also think about exposure because that is such a big part of the risk assessment. If you look through the studies, these safety assessments, they do actually distinguish between facial use and body use because your body has such a large surface area and you're putting it everywhere. So I think a really good strategy, which is one I use, is just try to cover as much of your body as you can with sun protective clothing. And that's actually better because, mornings. And that's actually better because sun protective clothing obviously doesn't need to be reapplied. You can't miss a patch as easily, maybe if you have a hole in your clothes. That means that you have less surface area to apply sunscreen to and reapply sunscreen to. It's a lot more convenient. It's also safer in terms of exposure. So my personal approach is really just to do that. And maybe if I'm pregnant, then I might try to avoid 4-MBC and homosalate if I use a lot of sunscreen. So obviously this might not be the same if you're an outdoor worker who can't wear a lot of clothes in the sun and you do have to apply tons and tons of sunscreen. You might have a slightly different risk assessment for yourself. But I think for most people, that is probably very fine and safe and practical.
That's really reassuring because when I went through the medical guideline databases, because that's how I base my clinical practice, is what do the guidelines say, and then try and follow those as best as possible. So when I saw that there was some concern about, particular sunscreen ingredients, possibly causing issues with testosterone levels or, whatever else may be, that led me into thinking, well, everyone should just be using a mineral-based sunscreen because that's what the clinical guidelines have to say. So it's reassuring to hear you say that they have rigorously tested this, and that they've got very appropriate safety levels in terms of how much you can actually be exposed to. So on the point of safety, though, what would be the safest chemical ingredient then if you were looking for a particular sunscreen?
I would say it would be the newer sunscreen filters. So these are things like, honestly, I'm not going to be able to pronounce half the names off the top of my head, but things like bimotrizinol. A lot of the time, if you look up just like newer generation chemical sunscreens or second generation chemical sunscreens, you'll see the names. And yeah, they have word names like Tinosorb S, Tinosorb M, Euvinyl A plus, but those names won't be actually on your sunscreens. They'll be the proper generic chemical name.
Is there a particular brand or type that people should be looking out for as to get them started on that research path?
Basically, most non-US brands will use some of these. Like in Australia, even some of the Woolworths sunscreens, like the ones in our supermarkets, the super cheap ones, have them. A lot of French brands have them, like La Roche-Posay. A lot of Asian brands, especially Korean and Japanese brands, like Biore. Wow, I've forgotten names. Shiseido.
What's the sunscreen you use?
I use a lot of different sunscreens. I mostly use, I don't think I'm allowed to say with the new TGA guidelines, but I use a lot of different sunscreens, and some of my favorites are from La Roche-Posay and from various Korean brands like Beauty of Chosun.
Okay, awesome. So, again, I'm super reassured by that because I've been currently using a zinc oxide sunscreen, actually based on your recommendation. I think it was Alta MD. But yeah, it's not perfect, and I use another zinc oxide just for my arms, and again, it clumps and everything. So it's reassuring to hear that we can actually safely use a chemical sunscreen, particularly the newer generations ones that you're describing.
Yeah, I have to put a caveat in there because there is, most of this data is obviously on animals because we can't ethically test on like pregnant women, for example. So there is always a possibility of new data coming out and new limits and that sort of thing. But it is usually a very precautious sort of limit. And if you look at the actual effects that set that limit at where it is things, it's not really like that concerning in terms of the effects. So it will be something like, for example, for oxybenzone, the effect that set that limit is actually a decrease in the number of sperm producing cells in the male rat fetus. So it's like a tiny trigger like that, which I guess it is sort of concerning, but at the same time, it's like, it isn't like there's reduced sperm production, for example, like something properly determined. It is super, super precautionary.
The next thing I always recommend to my patients that I see in the clinic, aside from sunscreen use, is to use a retinoid cream, particularly at night. So I'm curious to hear what your overall thoughts are on retinoids and if there's a particular brand and particular time of day that they work best.
Yeah, I think that's an excellent recommendation. I think almost everyone agrees like the two main things you have to do if you want to preserve your skin is sunscreen to reduce damage, and retinoids are going to be the best thing to undo some of that damage. So tretinoin is a really good option and different as well. I think the main reason they're such good options is because they are medical products, which means that there's a lot more regulation around their quality, around their stability. I personally also use some cosmetic retinols as well. And the reason for that is that with drug products, because of all this regulation, a lot of the time they're just like the active ingredient in a base, a really generic base, which I'm sure a lot of people, if you've tried a retinoid, you'll know that if you get the prescription ones, it's the same base as they use for like foot fungus cream. They just use the same sort of generic, very robust base for it. And so it's not the best texture. It doesn't have a lot of other supporting ingredients that make the texture nicer and also reduce irritation. If you've used a retinoid, you've probably noticed that when you start using it, there'll be a bit of irritation and peeling. Sometimes that goes away. Sometimes if you accidentally use too much, it'll come back. So cosmetic products get around that because they're allowed to have a lot more elegant bases with more supporting ingredients. And so sometimes I prefer to use those. So yeah, I use prescription tretinoin. I use the 0.05%, and then I dilute it with a nicer moisturizer with some of those supporting ingredients to try to undo some of that. And I also really like retinaldehyde, which is one of the strongest cosmetic retinoids you can get. And my favorite brand for that is Medik8. It's a bit pricey, but it is like a really lovely base. And there's also one from Paula's Choice, which I really like, which is a 0.3%, I think, retinol, also with 2% bakuchiol, which is an ingredient that also has anti-aging properties. And it's just, again, a really nice base that's just a one product that you can use, and that can be your only product for the night. In terms of time of day, nighttime is generally safest for retinoids because they do decompose in light, but there are some that are not affected by light, like Differin.
Yeah, I personally use the tretinoin at night, and I, routinely prescribe that to my patients. But coming back to the safety, because again, I think most people following my channel will understand the benefits of a retinoid cream. One of the things that I didn't actually realize until I started looking into a bit more of the safety around retinoids was this idea of reduced facial fat. And I haven't necessarily looked into the research myself, so I was curious to hear what you think about those safety concerns.
Yeah, I see that around on the internet a lot. And I also didn't look into it for ages. But then when I did, I realized it's on one in vitro study from 20 years ago. And it was not even in human cells, it was in mouse cells. And there were no follow-up studies on it from 20 years ago, which means either people didn't find it interesting enough to follow up on, or they followed up and they didn't find any interesting results. And also it was suggested, it's been suggested several times as a potential cellulite treatment. And there wasn't any follow-up on that either, which really makes me think it's not a real effect. And I think most people are actually seeing loss of fat as they age for other reasons. And it's correlating with when they started with this anti-aging cream. And also most of our vitamin A exposure is from our diet by far, and not from topicals. So again, I think there would be more signals if fat loss was a real issue from vitamin A exposure.
Okay. No, it's fantastic to have this discussion with you to actually reassure all of those safety concerns. So, I religiously use the retinoid at night, and that's on my face. But what about the rest of the body? What about the arms and the legs? Should we be using, a retinoid soap at night when we're going for a shower to actually expose the rest of our skin to a retinoid?
That's a good question. The main concern with putting it all over your body is there are liver and teratogenic effects of vitamin A overexposure. I think everyone's heard about, if you eat too much liver, then you end up with vitamin A poisoning, that sort of thing. It doesn't seem to be a huge concern because you aren't absorbing that much through your skin compared to if you ate it. But perhaps if you're pregnant, it might be good as a precaution to not put it all over your body, but otherwise I think it's not a bad idea. It's relatively safe. In terms of delivery, there are some body products now that have retinol in them, so I probably recommend a body lotion, some sort of leave-on product, rather than a soap which washes off. It's just like a more efficient delivery mechanism because it stays on your skin for longer. Usually, things generally have to stay on your skin for about 5 to 10 minutes at least to saturate the top layers of the skin. So most of the time, I don't think most people want to stand around in the shower for 5 minutes with soap on them. So I think, body cream is probably a bit more practical than a soap.
And you mentioned a couple of other ingredients in the base. What type of ingredients actually make a difference in terms of skin health?
So retinol works really well, I think, with anti-irritants. There are lots and lots of ingredients that will be anti-irritant, but at the same time, if your skin is really tolerant, then you can probably use it with in conjunction with more irritating products as well. So in terms of anti-irritants, antioxidants tend to be good. So vitamin E is a classic antioxidant that's added to most products to reduce irritation. There's also vitamin B3 or niacinamide, which is, again, really good at being anti-irritant and also not increasing irritation while also having some anti-aging effects, which is rare. If your skin is a bit more resilient, then maybe some chemical exfoliants would also be helpful.
Okay.
But yeah, there's a huge list.
Yeah. Let's start with vitamin B3, because that's one of the things that has kind of blown up in the anti-aging space because of, NMN supplements, nicotinamide riboside supplements, and I personally take a niacin supplement, so 50 milligrams. There are some clinical guidelines that suggest that actually we should be using it in creams as well. So I'm just curious what you think about if you're already supplementing with vitamin B3, would there be any advantage for actually putting vitamin B3 in the skin products as well?
Um, Generally, yes, because your skin is one of the last places to get stuff from your diet because it's so far on the outside. So, and also vitamin B is water soluble, so it gets peed out as well. So, yeah, there is benefit to putting it on your skin, and most of the benefits that have been found for niacinamide, they were done on like a normal population, not a vitamin B3 deficient population. So, yeah, there should be some benefit, I mean, most people aren't really deficient in vitamin B3 anyway these days. So, yeah, in terms of what it does, I'm mostly familiar with the research on skin cancer, and it seems to help with that. It also seems to help topically. So, topically, the benefits have been found to be evening out skin tone. So, it will help with brown pigment as well as yellow sallowness and blotchy redness, I believe was the specific terms used in the studies. It also seems to help with rough texture, and it can potentially replace ceramides in the skin. So it helps the skin production of ceramides, which are fatty molecules that help your skin barrier stay intact. So it stops irritants from getting in, stops things like water from coming out. It also seems to help normalize oil production of skin, and there does seem to be some anti-skin cancer effect as well. Most of these studies are relatively preliminary, but it does seem like it does do a lot of stuff. The disadvantage of supplementation, I think the main one is really just the flushing reaction that some people get with the niacin, so it's a bit uncomfortable. It tends to happen a lot less topically, so if you find that's a problem, then obviously you can take the supplement at night instead, but yeah, using it in a cream, if you're just using it for skin effects, will be a good alternative.
Okay. Okay, no, that makes sense. I mean, it's a similar line of questioning around hyaluronic acid supplements, because when I first started to look at hyaluronic acid, I thought this was just complete BS because it's a large molecule from a supplement. How could you possibly absorb it and for it to get into the skin? But when you have a look at the randomized placebo-controlled studies, there does seem to be a true benefit here. So I personally take a hyaluronic acid supplement, and I'm on the fence about whether it should be included within the skin products as well, in terms of the creams and whatnot. So yeah, I'm curious to see curious to hear what you think about including hyaluronic acid in a skin cream.
Yeah, so I'm not that familiar with the supplement research, but when you eat something, a lot of the time it gets hydrolyzed into smaller particles that can get absorbed. But on a cream, that doesn't really happen on your skin. So topical hyaluronic acid is really just a hydrating ingredient. It's got lots of OH groups that can bind to water and keep water on your skin, make it hydrated if your skin is not that good at doing its own hydrating. But it won't get into the dermis, which is where most of the hyaluronic acid sits to keep your skin plump. So yeah, it is pretty much a hydrating product only. It's not going to have any long-term effects, but it can still be really useful for some people. And that's the same with collagen as well in creams.
Okay. No, that's great because, yeah, I wanted to take a supplement that it would actually, I wanted to have a therapy that would actually help the dermis of the skin. So, there is quite good human data showing that the hyaluronic acid supplements do affect the dermis and do seem to increase the amount of hyaluronic acid production in the dermis. So, yeah, thank you I suppose, for saving my money in that regard, because I won't spend money on a hyaluronic acid cream. But yeah, to the point of collagen. So once again, I take collagen peptides because of the human research that we've got. in particular from a 2020 meta-analysis of human clinical studies showing that, yeah, taking collagen supplements compared to a placebo does result in reduced wrinkles and whatnot. So should collagen supplements, should collagen also be included in the skincare products as well?
Yeah, so collagen in a cream, that will only really hydrate your skin. Again, it won't get down deep enough. In terms of supplements, I'm kind of on the fence about recommending it as like a blanket thing for everyone. Because, yeah, I think the evidence isn't really that solid. A lot of it was sponsored by the companies who made the collagen, but at the same time, there is research with the clinical trials as well as with more mechanistic research where they gave people hydrolyzed collagen and they measured their blood levels. And they also compared it with collagen from the diet, and they found that the hydrolyzed collagen absorbs a lot better than anything from, let's say, chicken, for example, which I see as a recommendation from a lot of people. Just eat meat and you'll get your collagen. It's not really the same. But it is also quite expensive as a supplement. So yeah, I would probably recommend to most people like use sunscreen, use a retinoid, use exfoliants first, and then if you have the money and you want that extra benefit, then choosing a collagen supplement is a good option, which I'm guessing is your situation.
Yeah. What convinced me, again, I went into the collagen research with a very skeptical mindset. And yeah, I was just surprised by what's already out there. There are, I think now over about 13 or 14 different randomized placebo-controlled studies that are double-blind. And yes, they're sponsored by the companies, but in terms of the methods that these papers are using, that they're sound. And you can see over a 12-month period that there's improvements in wrinkles and skin hydration. So that's what convinced me to start taking the collagen peptides. But you brought me to the next point that I want to ask about, which is exfoliants. I must admit, I'm a bit skeptical about it because I want to make sure that any treatment that I'm doing, I would have thought you'd want it to be targeting the dermis, and exfoliating your skin, unless you're doing it super deep, which you probably shouldn't be doing, shouldn't really be affecting your dermis. So what's the advantage of exfoliating your skin, and why should people do it?
So essentially, it is largely a superficial sort of maintenance product. So normally your skin cells shed about one layer of skin per day, but this shedding process can be disturbed by lots of different factors. Like obviously, as you age, most of your body starts slowly, getting a bit crap, and that's one of the things that starts to slow down as you age. But also things like hydration. So if there's less water around, then your skin doesn't do this as effectively. And so you'll get this buildup of this uneven buildup of dead skin cells that can make your wrinkles look more pronounced and also give your skin a rougher texture. And if you're looking for that sort of smooth skin glow, then a lot of the time that is a very superficial thing. Obviously, there's also all the plumping from the dermis, but there's also that top layer of skin that interacts with light. And so if you want that smooth glow, then having an exfoliator is a really good option. And also it also can unclog pores. So if you get clogged pores, which also leads to bumpy texture, if you get acne, then exfoliation is also a really good option. There are also some exfoliants that seem to be able to get deeper and do other things as well. So I'm mostly talking about chemical exfoliants like lactic acid and glycolic acid, and they seem to be able to reduce pigment. Part of that is also just like increasing the rate at which your skin cells are coming out and bringing the pigment along with it. But some of that seems to also be some sort of deeper action within, deeper in your skin. So yeah, if you have any of those problems, then that might be a good option. Also, some of them might be able to get deep enough to affect collagen in the dermis, like as a secondary mode of action. But yeah, it does seem like if you go off and do proper chemical peels in a dermatologist's office, for example, where they'll leave a higher concentration for a longer time and you usually end up with more irritation, maybe actually some visible peeling, then that seems to get to the dermis a lot better. But yeah, using a small amount topically might help with that.
So what are some of the home options that people have got if they did want to go down the path of exfoliating their skin?
So there are a lot of chemical exfoliants on the product now. A lot of chemical exfoliant products on the market now. There's some really inexpensive ones from The Ordinary. So they have a lactic acid product and they have a glycolic acid product. I find that with The Ordinary, although they are really cheap, some of their products are like not super, I guess, as suitable for general skin. So their glycolic acid tends to be really strong and their lactic acid tends to be really weak. So yeah, you can use the glycolic acid and dilute it maybe, like use a really small amount in a moisturizer. But yeah, there are lots and lots of different glycolic and lactic acid products on the market. I would probably recommend using a lactic acid one first because it tends to be gentler. There are also other types of exfoliants like scrubs, for example, and gamages, which are products that kind of ball up on your skin. There's also enzyme exfoliants. So those are all a bit more superficial than the chemical exfoliants. So yeah, I would recommend probably just experimenting and seeing what works best if you're looking for that glowing sort of skin look. It's a really quick effect, so you'll see it within a few days. And I would probably recommend not going too hard at first because then you get into over irritation and you kind of have to stop using everything for a while. But yeah, I would probably recommend just, yeah, trying it out and seeing what works best for you.
So how often would this typically be done as a maintenance? So say you've sensitized your skin. Is this something that you do every day or every sort of second or third day? Yeah, how often would you exfoliate?
I think for most people, it's either once or twice a week.
Okay. Okay. That kind of brings me on to cleansers. So, for teenagers that see me at the clinic, we want to make sure that we're trying to do what we can to help their acne. So I can understand a good cleanser then, but if you don't suffer from acne in your later years, what's the advantage of spending, money on a good cleanser?
Honestly, I don't think expensive cleansers are necessary. Unless your skin is really, really picky and it only reacts nicely to like a really expensive one, I think cheap cleansers are enough. The advantages of cleansers, like you said, one of the things is with acne, so your own skin sebum, that oxidizes and that can be an irritant for acne. It can also potentially contribute to skin aging. And there's also pollutants that can stick to your skin, and those can also potentially contribute to aging. Again, how much of an effect that has, I'm not really sure, but at the same time, you probably don't need a really expensive cleanser to get rid of that. Yeah, and otherwise it's just, getting sunscreen and makeup off your face at the end of the day. But yeah, I think a lot of people probably don't need a cleanser and probably won't see that much benefit from a cleanser, but at the same time, some people will. So I personally wear sunscreen and makeup, so I'm obviously going to need a cleanser. But in terms of the anti-aging effects, a cheap one will do.
So in terms of the anti-aging effects, about actionable things that people can do. So we've talked about sunscreen, we've talked about retinoids, vitamin B3. I'm a fan of the hyaluronic acid supplements and collagen supplements. Is there anything else that people can do to slow down or even reverse the signs of aging?
I think a lot of people underestimate the sunscreen, so I'm going to harp on about that for a little bit. So sun protection is honestly the biggest thing that you should be doing. And most people don't realize it's not just when you go into the sun, when you go to the beach or whatever, it's also all those in-between times. Even if you're sitting next to a really large window indoors where the sun is shining in, that can also have a really huge effect. So in the biggest clinical trial on sunscreen, which is the NAMBA trial, they looked at discretionary use of sunscreen versus everyday use. And they found a huge difference in the aging. So people who are using sunscreen every day, they found that they had, I think it was over 5 years, and these people were middle-aged. And they found that there were no increased signs of aging. So that's pretty impressive. There's also been other trials since then on this specific anti-aging issue. And yeah, it looks like it is super useful. Especially if you're living in, let's say, Australia or New Zealand, where we are, we get a lot of sun, we get a lot of intense UV. And so, yeah, sunscreen every day. It's not just for the beach. You should be having some sort of thought about sun protection every day. Apart from sunscreen, there's also obviously hats and sunglasses. Several cosmetic doctors are now selling hats and sunglasses because they've seen so much benefit from for their patients. And obviously, you don't have to buy the cosmetic doctor ones. You can just buy generic big hats and sunglasses. So yeah, highly, highly recommend that. Also, if you drive, one of the kind of tropes of aging is that you see it on the back of your hands. And I think that's also a very ignored area. So yeah, protecting your skin against damage is a lot more effective than trying to undo it or trying to fake it with fillers or whatever else at the end. So yeah, big spiel on that. So if you're already using a sunscreen, then obviously adding a retinoid, especially if it's one of the stronger ones. So tretinoin, adapalene, tazarotene for the cosmetic one. Sorry, for the medical ones. And then for the cosmetic ones, we have things like retinol and retinaldehyde. Having a good, stable product of one of those is going to be the next thing you should be doing on your tier. If you want to go lower on the tier in terms of less evidence, but still as much evidence as we have, then I would probably go with the chemical exfoliants, glycolic acid and lactic acid, because again, they can potentially have deeper effects, especially if you go and do peels, for example. Niacinamide, vitamin B3, is also another one which has a lot of effects. Particularly with pigment. So people with darker skin, more melanated skin, including East Asians who have lighter skin, but their skin is very capable of producing lots of pigment, like me. The way we age tends to be with uneven pigment rather than uneven texture, which is how white people tend to age. They tend, with white skin, that tends to turn into wrinkles, whereas with Asian skin, we tend to not get as much of the wrinkles, but we get lots and lots of freckles. So yeah, niacinamide has been really good for pigment for years. It's actually the main ingredient in those controversial Fair and Lovely creams that are kind of like skin bleaching-ish creams. Basically, yeah, your skin can't tell if something is hyperpigmentation or not, but this tends to promote even skin. So yeah, niacinamide is really useful. If you do have more pigmentation issues and niacinamide isn't really doing it, most of the time you're going to have to go for a medical option. So that's either hydroquinone, for example, which is a stronger topical that has to be used. I would highly recommend using it under the supervision of a doctor, because if you use too much, it can go the other way and actually kill the pigment producing cells and you end up with white marks. But there's also stuff like lasers. Laser technology has improved a lot in the last 10 years. And so now there are lots of lasers that are very safe for darker skin. Again, you will have to find a practitioner who knows what they're doing and has worked on similar skin to you, because so much of it is dependent on the person using the laser on you. Yeah, other in-clinic procedures are things like Botox. Botox is mostly just, it kills the nerves that activate the muscles. So if you have a lot of wrinkles in motion, then it can firstly temporarily stop you from having those wrinkles when you make facial expressions. But also, skin is a bit like leather. So whether or not you get wrinkles depends both on the condition of the leather, which is what we're trying to do with these skincare products, but also on how much you bend the leather. Like the more you bend it in one place, the more it wears down and you end up with a permanent wrinkle. So that's where that whole preventative Botox idea comes from. If you are prone to getting those expression lines and you don't want them etched in deeper, then that could be a good option. Yeah, going down the list of less well-supported and maybe higher effort, obviously there's collagen supplements, which we talked about before. Also, maybe there is this thing where if you sleep on your back, that also stops etching in the wrinkles, because if you sleep on your side, then you end up getting those vertical sleep wrinkles, which can get etched in over time. So again, that completely depends on whether you can sleep on your back. If you can't sleep on your back and you're losing sleep, then that's probably going the other way.
So if we try and sum things up in terms of a skincare routine that people can do to be, optimizing their skin health and trying to slow down as much of the signs of aging as possible, are there any good brands that you can think of that in terms of the sunscreens that have got a good, chemical ingredient in terms of the second generation and newer ones, but also mix in things like niacinamide, so that you're only having to apply one cream instead of two or three.
I'm trying to think of some, but yeah, it's kind of annoying because in Australia, a lot of the sunscreens don't actually have their inactive ingredients on the package, and by inactive, they include things like niacinamide, which aren't regulated as drugs. So the ones that come to mind immediately are probably Korean sunscreens. So niacinamide is classified as a special functional cosmetic. Oh, sorry, products with a certain percentage of niacinamide and adenosine are classified as functional cosmetics for anti-aging in Korea because they recognize the anti-aging effects of niacinamide. And so that combination tends to be combined with sunscreens a lot of the time. So yeah, there are a lot of Korean sunscreens with niacinamide in them. And actually, some people are allergic to niacinamide. So I get a lot of comments asking me for non-niacinamide recommendations. And there's barely any Korean ones. So yeah, if you're after niacinamide, Korean sunscreens are probably the way to go. There's also
And that's the
brands.
second generation chemical sunscreens as well.
Yeah, they have this. They use a lot of the second generation ones. Although with Korean sunscreens, they tend to be more kind of commuter sunscreens. They're not really designed for hardcore use. So if you're going on, let's say, a hike, then it's probably not as good an option. If you're going on a hike, I would probably go for a waterproof sunscreen from a place like Australia, or water resistant rather. That's like made to be more hardcore, but a lot of the time with those more hardcore ones, um, they're not as likely to have the newer generation filters. If you're willing to spend a bit more, then there are a lot of French sunscreens that have really high resistance, really high UV protection, lots of new filters, often combined with older filters and often combined with titanium dioxide as well. And those ones, I don't know if they tend to have niacinamide though, so I don't think it's really a one-off, but yeah, I think it is a bit of a choice. If you're going for a hardcore sunscreen, it is probably only going to be a sunscreen. If you're going for something more everyday, then you might be able to find actives like niacinamide in them as well.
Okay. So, and continuing the theme of trying to sum things up, what's your skincare routine?
That's a good question. I have ADHD, so I cannot do a long routine. So it's probably a lot shorter than a lot of people expect for someone who's this into skincare. So in the morning, I pretty much just wash my face with water. If I'm going outside, I will put on a sunscreen. If I'm not, if I'm staying in my office, which is here, it actually looks brighter than it is, but it is basically a cave. I have a window with tons of trees blocking the window, which means that there's not that much UV coming in. I did a calculation, and just by sitting in my room, I get about SPF 300. So I don't bother wearing sunscreen indoors. If I leave the house, then I will put on sunscreen. Then at night, I usually clean my face in the shower. There is this whole thing about like how if you clean your face in the shower, you lose all these hydrating components of your skin, but I don't shower very hot and I keep my face like it's just faster, runs down my body, done. And then I'll usually use two products at night. One will be an active product and one will be a moisturizer. So my skin is quite sensitive to retinoids, so I can only use it about once every 2 or 3 days. So I'll use usually tretinoin or a cosmetic retinol, depending on how irritated my skin is. And then on another night, I will use a chemical exfoliant, either an alpha hydroxy acid like glycolic acid or lactic acid, or salicylic acid, which is better for acne. I get a lot of clogged pores. Sometimes if my skin is feeling really robust, I'll just combine them both. And then on the third night, usually I'll use something either vitamin C based or vitamin B3 based. Yeah, and then I'll also use a moisturizer on top. A lot of my moisturizers now, they have a lot of active ingredients, which are, I guess, less well supported, but they're really non-irritating and they just work nicely in a nice, smooth moisturizer that's also quite soothing. So at the moment, I'm using a really fancy one from Sulwhasoo. which has ginseng extract. It's a really popular product in Korea. There isn't that much independent evidence on how well ginseng extract works, but I'm kind of just, it's kind of just an add-on, like just in case it does something. And it just feels nice and seems to calm my skin down so that I can use more of these irritating products more frequently on other nights.
Oh, fantastic! Because one of the things that I need to be aware of when I'm prescribing any form of treatment for my patients is trying to keep it simple. Because if you keep things simple, then people are far more likely to actually do the treatment that you're recommending. So it's nice to hear that your treatment protocol is actually relatively simple. You're not having to spend hours and hours in front of a mirror doing all sorts of things for your skin. So that's awesome. Michelle, this has been a real pleasure. Where can people find you if they want to find more information?
So I'm Lab Buff and Beauty Science on Instagram, TikTok, YouTube, plus I have a blog.
Awesome. Well, yeah, like I said, this was awesome. I've certainly learned a lot, and I'm sure the viewers will really enjoy it. So thank you.
Thank you so much for having me.